All right. So I just made this presentation where I'm kind of just going over the figures, but I think this is a really exciting paper for us as a group. We're very interested in studying open surgery, both in the simulation setting and intraoperatively. And I think this data set as well as your methods really capture kind of the things that we're trying to do and are moving the field forward, especially the fact that the data set is very easy to download and that you made um, your code available to use very easily. So just to go over the data set very quickly. In this paper, it's a simulation data set that was initially developed to evaluate the utility of kind of a heads-up display for teaching students how to suture. And so the way that study was set up is medical and dental students were given an instruction sheet on how to perform a simple interrupted suture. They were then given 5 minutes to tie as many of these as they could and recorded during that. And then after that session, they were put into one of three learning groups for an hour. They either received just e-learning or instruction from the heads-up display or tutor-led feedback. And then after that 1 hour training, they were again recorded performing the same task. And during both of these sessions, their skill was evaluated from the video using OSATs across 8 categories, which are then summed up to come up with this global rating score, where novices are anybody who has a score of 16 or below, intermediate is 16 and 24, and then proficient is 24 or above. And so that was like a separate paper. And so the analysis in this paper is using that data set to then train vision-based models to try to predict skill directly from the video. And so figure 1 in the paper is just kind of an example of a frame from the data set. So we can see, very clean, focused on the suture pad from that bird's eye view using the GoPro. You have just the surgeon's hands in view and then the instruments that they're using. And then on the right is the distribution of the scores in the data set. And one thing to note is that there's a slight bias for the edges. So there's slightly more examples of novices and proficient scores, and then there's a dip in the amount of intermediate scores available for training and evaluation. In figure 2, they just highlight the differences in the ratings between the different raters. So this data set, the way that the ground truth scores were developed was 3 surgeons graded the videos using OSATs, and then the average rating across those people was used as the final label for the ground truth. And so in general, we see pretty good concordance of the raters. There's a Pearson correlation of 0.8. There's a slight bias in rater B, who seems to kind of more highly grade the scores overall, but in general, there's pretty good agreement. And then in the plots on the bottom, what we can appreciate is that the agreement is usually better for lower scores. And then as scores get higher, there's more discrepancy in the overall grading. And so you can see kind of the gap on the left, smaller for these, and then it gets a little wider as you go to higher scores. And so figure 3 and 4 kind of highlight the approach, but so what the purpose of the study was to take these videos and to try to predict the score. And the way, there's kind of many different methods to try to do this. The way that they designed their setup was to use this temporal segment network, which is an idea in action recognition where you take as input your video and you're creating an architecture where you're dividing that video into equally spaced segments. And then your model will take different random snippets from each of these segments and then run them through a backbone architecture, which I'll show in the next slide. And so each snippet is then assigned a label. There's a consensus layer that brings all those labels together to then create the final label and output for your video. So this is just an example of that temporal segment network architecture where you're dividing the video into equal segments, and then kind of every training step, you're taking just a snippet of each of those segments for your evaluation. And so figure 4 kind of highlights the general architectures that they trained in their work. So again, as input, you're taking a full video, which in this case is a 5-minute video. Then you're building this TSN network. So the first part of that network is to break down the video into those equal segments and snippets. Then the individual snippets are fed into the backbone network. These then put out the labels, which are then aggregated together in a consensus layer to give you the final label for your video. And so in this case, the backbone network that was used, there was 2 of them that were evaluated. So one model was i3D and the other one was Video Swin, and both of these were pre-trained on the Kinetics 400 dataset. So table 1 is the first table with results. And here on the left, so 4 different networks were trained with different backbones. So there's i3D, and then Video Swin was the other network trained, and the different size of that backbone was used, so tiny, small, and big. And we can see here the class-wise F1 scores for the different categories of skill. And so I think what we can appreciate from this table is just the greater performance for novice and proficient scores, and then the kind of drop in performance for intermediate, which will be kind of a theme for the general results. But overall, pretty good F1 at least 0.79 or above for novice, and just a little lower for proficient. Table 2 looks at varying the length of the segments, or the number of segments that are taken from the video, as well as the length of the snippet. So the video that was trained in this model, it was recorded at 30 frames per second, but the actual training was on 5 frames per second. And so the individual snippets varied from 64 to 75 frames. So that's about 12 to 15 seconds of video. And then the videos were split between 10 and 12 segments. And the main takeaway point from this figure is that generally what was observed was that having more segments, but keeping the snippets shorter rather than long, led to slight improvements in performance. And we can talk later about what that might mean about what's going on within the video itself and how to think about analyzing surgical video. Figure 5 is taking a look. Obviously, we had seen this kind of drop in performance in that intermediate group. And figure 5, I think, is a nice way that the authors represented how to kind of look into what may be going on within the model to understand why there's that drop into performance in the intermediate scores. And so the x-axis is the ground truth score, where each dot here represents one video from the test set. A circle represents the correct model prediction, and then X represents an incorrect prediction. The color is the skill, and then the boldness is when we look at the ground truth raters, what level of disagreement there was with the different points. And I think some of the takeaways here is obviously we see the more misclassifications in the intermediate range, but that's also generally where we're seeing some of the kind of disagreements between raters. And we're also seeing generally disagreements between raters kind of closer to where those differences between novice, intermediate, and expert ratings are, which kind of makes sense. And then the final table, table 3, what we wanted to look at. So if we think about the ground truth data set, this was generated by averaging the scores that each rater assigned, but we can actually look at the class-wise F1 score of the individual raters relative to that ground truth data set. And this can kind of give us a sense of how well does the model perform, not just overall, but compared to other expert raters, and can give us a sense of, obviously there's going to be inaccuracies in these models that we develop, but we're interested in developing models that perform as well or maybe better than expert surgeons. And this is a nice way to kind of represent that. So again, we see that all the raters classify novices and proficient skill levels pretty well, but there's also this drop off in performance with the raters as well as the models in the intermediate for that intermediate level classification. So that's all I had prepared today to just kind of go over the findings of the paper, and I'll stop sharing my screen now, but I think we've prepared a few questions that I'm happy to go through, or maybe Sophia, if you have them in front of you, we can kind of ask, or if anybody has any questions in the presentation or any thoughts before we jump into those.
Well, why don't we start with any clarifications or thoughts that you guys might have as it relates to the presentation? And do you guys have anything that you specifically wanted to mention as it relates to the way in which we describe the results of the work that you did?
Yeah, so thanks, Guillaume, for the really great summary. I think you basically touched all the important parts of the paper. I actually have prepared some slides that I could
Awesome.
show for since the paper is also kind of, it's been a couple years, kind of also showing, okay, what have we done since then? Maybe some details to provide there that I could show.
Amazing.
If that's interesting, then let me just see if I can share my screen. Should be fine. Okay. Okay, can you see the slides?
Yes, and I can also see my face in the middle of
Oops, hang on. I just close it. There we go. That's better, right?
Yes.
All right. Okay, so yeah, basically we've already introduced ourselves. I'm Hannah, and that's Isabel, and maybe some initial details are also kind of going into the questions that you had sent us beforehand. I think one addressed looking at instead of using a classifier, if we used regression instead, and we actually, in fact, looked into that directly after the paper publication. We, instead of having the classifier head at the end, maybe I can show with the laser pointer, here we go. We just replaced it with a regression head and directly output the gears or the global rating scores with the result that, so we see here kind of the result. It's fairly similar in performance, so it's not really too bad. It's quite good. But essentially it doesn't make too much of a difference if we use the classification or the regression, or also using a classification on top of the regression. But what we see again is kind of keeping in mind how the data is distributed. So we have this clustering in the low skill areas, and then again, what we see reflected from the rater scores, or also the rater distribution, or better said, the agreement, is we have this kind of divergence that happens once the scores get a higher or into the higher range. And that was kind of a bit that I wanted to touch in general a bit in more detail from the paper, or kind of from what we covered in the paper. I think Guillaume already covered a really good area on it, so I can skip a couple of these things. This image, what we have here, is essentially the same image as that was in the paper, just instead of comparing the raters to each other, it compares each rater to the ground truth. And so, like Guillaume said, we have this clustering in the low skill area, and then the ratings kind of diverging or having a higher variance once the skill ratings get higher. And we essentially see that raters see, or there's like a certain bias that the raters each have in comparison to not only to each other, but also in comparison to the ground truth. So rater C tends to have a lot lower rating, and rater A in turn is also slightly lower, but is more actually towards the ground truth. It doesn't have as much difference that we see here. And whereas rater B has rates typically a lot higher than the ground truth. And we also looked at the individual rater agreement for each category, and certain categories that, or it's kind of expected that they have lower agreement. For certain categories like respect, where just the definition is kind of vague. Other categories like suture or final quality have higher agreements, which makes sense because I think the definition of them is more concrete, or is there's just maybe it's easier to agree upon, essentially. What I think is really interesting from this, though, is that the knowledge category, which is short for knowledge of procedure, is actually the highest agreement category that we had.
Mm.
And I kind of wanted to look at that because, so here I showed the actual definition of the individual rating score with its definition. And so a rating of 1 is called deficient knowledge. And a rating of 3 means that they knew all important aspects. A rating of 5 is that they demonstrated familiarity with all aspects. And here, what I kind of ask myself is, so what exactly is the difference between, or what's the nuance between knowing all important aspects versus demonstrating familiarity? So that's why I think it's kind of interesting that this knowledge category, even though I think it's quite vaguely described, or there's still a lot of room for interpretation, is actually the highest category of agreement.
Mm.
That was kind of really interesting from that analysis.
Well, what do you have the distribution? Just as one tiny, do you have the distribution of that rating? In other words, was it just that the reason why the inter-rater uh, concordance was so high, could it be because everyone just said 5, or is it there was, clear distribution of the ratings across the different students?
That was kind of um, the hypothesis, I'd say, is that it kind of has to do with the nature of the study, that we had the people, or the students that basically had the initial training session, then that 1 hour long training, and then sutured again. And that it's kind of clear that at the beginning, probably all had a score of 1 or 2 maybe. And they didn't really display significant knowledge of the procedure. And then later on showed familiarity. So then in turn had higher scores. That's
Got it.
kind of the interpretation why that may have had a higher agreement amongst the raters.
Mm-hmm.
Yeah, I think it's also a general thing with the rater agreement, is that usually it's easy for them to agree if some recordings are really different. So it's easy for them to distinguish between absolute beginners and absolute experts. But then just the finer nuances are always really difficult to get consistent.
Mm-hmm.
Yeah, which I mean is kind of what we saw when we looked at the individual rater scores. So what we essentially did is we took the rater global rating score themselves, classified them into these 3 classes, and then compared that with this ground truth average. And this was also in the paper, but I kind of wanted to really go into the details of this table because, kind of like Isabel just said, is having this dip in the intermediate class is also the same thing for the raters. It's not just the models that have a difficulty identifying this, but it really essentially comes from the nature of the study, but also just that it's difficult for the raters themselves to really find the nuance between what is now the difference between as an intermediate or intermediate and proficient.
Mm-hmm.
And essentially, this was, I think Guillaume basically handled this enough that the model performance is essentially basically hits the performance of the raters themselves. So kind of the future direction that I kind of think of is that the models that we have for skill assessment don't really, or most likely will not actually reach this 100% accuracy or 100% F1 score, or whichever metrics we use, just because the raters themselves will always have some sort of disagreement and have some sort of nuances that are different. And also what we've looked at in different studies actually using these AI models is that giving this good or bad feedback is not really enough. There needs to be more feedback. So that's also something that we have to move on from, or kind of look beyond, and maybe kind of hooking into that from, or continuing on what we've worked on in those directions, is that essentially you can look into, or we can look into proxies. So either looking at tool tracking, or also error recognition, seeing if certain pegs are dropped, like in this data set, for example. And not just taking these proxies as like standalone models, but basically combining them with the video analysis and video assessment, because that definitely strengthens the model performance. But also looking into some certain explainability methods, which we have here, where essentially we looked at the individual snippets or the little clips and looked at, okay, which ones influence the final score to become better or worse. And it's definitely connected with what happens in the video. So kind of taking this example, we see that the good segments or clips that are identified as having good performance, we see relatively smooth movements. There's not a lot of fumbling. There's no drop pins. Whereas, sorry, looking at the worst examples or the examples that worsen the score, there's fumbling here. They also, since this is a laparoscopic setting, they don't have a depth perception, so it's difficult. You see them missing actually grabbing this little cube. Or also here on the right side is where they have difficulties actually placing down the peg or the cube onto the peg. So there is some sort of information that is just also in the individual clips that we can also use and give as feedback for the students, which is more informative than just saying your entire performance was bad. And maybe one final thing. So last year and this year, we organized a challenge where we looked at this classification task that we had in this Aachen data or the AIxSuture data, also looking into, can we actually predict the entire OSATs category score, and also looking into tracking for surgical skill assessment. And what we kind of, maybe I'll skip this slide, but what we essentially got from this information, again, is that using this classification prediction, we don't really have much more that we can do there. We kind of are just capped by the performance of the raters. However, in this task 2, where we looked at predicting these OSATs, which I hope should actually answer another one of your questions, is that their performance from the model significantly dropped. So it's very, very difficult to actually be able to predict these individual OSATs in one part, because it's a big multitask problem. So it's difficult for the model to focus on a certain aspect. And also because we saw that in the earlier figure that I showed, that the rater agreement in these different categories is so much different, and there's so much more variability than in the whole basically smooth global rating score that we used. We also kind of maybe have one small graphic here, which essentially says the same information, also with this respect category. So these are the actual results that we have on the test data from the challenge data set, which is the similar data as the Aachen with the AIxSuture data set, where we see here kind of the stray or kind of the spray of the results. So I think that's about it for my slides. I hope I didn't go into too much length. I tried to keep it a bit more brief.
That was fantastic. That was fantastic. So I'm going to ask one question. I know that people have other questions. I think I'll make 2 points. The first is that your findings are very consistent with much of the work that we've done, where we've found, and Daniel can speak to this, we found the act of being able to predict OSAT score or global rating scale to be very difficult. And especially as you're saying, in that gray middle, it becomes extremely difficult because it's not even clear that we can cleanly define what that means. Because so even all the papers, if you look historically at the papers, that they wrote around peer-led review, what they were essentially identifying is they were identifying errors in performance. They weren't grading them through this entire frame and using that as some kind of meaningful representation to give them feedback. And so it's totally understandable that being in the middle is really this gray zone, which may not actually be able to be easily differentiated between a 16 and a 23. The question that I had for you, which kind of a broad meta question, is we found that in thinking about this, and you touched on it a little bit, if you were to take, let's say you have a 5-minute clip of somebody doing a specific task, and you were to show an expert only the first minute of that clip, you might get a different rating than if you showed them the last minute of that same clip for the same person. And I wondered, how are you thinking about that? Because that's something that we're thinking about quite a bit, in the sense that maybe one of the reasons why we're getting so much variation is because what's happening is people essentially perform differently at different times. So when I'm working with a student, there are times when their performance is excellent, and there are other times where their performance is poor. And essentially, what we're trying to do as raters is we're trying to average out the overall median or mean, or however you want to think of it, of the performance. But it's hard to do that, especially in these in certain situations when people are performing in having different levels of performance at different parts of a task.
Yeah, absolutely. I would totally agree with you that within a video or general within like a procedure or a task, there's definitely a fluctuation of skill just because people just have different, I guess, talents in a sense, or
Mhm.
are able to do certain parts of a task better. Maybe they will fumble with grabbing the needle, but can actually like the rest of the handling is really good. So I think there maybe also definitely needs to be a move towards, instead of having these whole videos annotated. I mean, it's obviously now a different question of annotation effort, etc. But maybe kind of taking that out of the question is that there should be more of a move towards, instead of having these whole averaged out ratings of a whole video, to actually have like more detailed information and ratings for smaller clips, and maybe possibly like phase wise, or I guess task specific or subtask specific analysis, than just having, I guess, kind of a smoothed rating over the entire video.
Got it. Daniel, do you have any questions? Because I could obviously ask questions all day long, but we're going to just do a couple more minutes of questions and then respect our colleagues here.
Yes, thank you, Hannah, for your additional comment. We really learned a lot from that. I have a few questions. First thing I need to clarify is about the ground truth. What is the ground truth of the global rating score? Is it an average of 3 different raters? This is my first question. And second is, I'm really curious about the distribution of the scores, because from your slide and from Gilon's slides, we can find that the distribution of the score is quite evenly distributed. But in our data, the maybe in simulative videos, trainees may have distributed scores, but in real open surgery videos, we found that the scores are quite high, because we know that they can't be low if they need to do sutures in the real body. So that would cause some like bias when we try to predict OSAT score, because maybe like 80% of a single arm is more than four scores, 4 points. So that's the question that I have for you, and I want to ask of your opinion, or how do you manage that? The third question is about the strategy of your model, and you split the whole video into different segments, and then use the snippets. And my question is, will that break the whole video into very like fragile? Does that affect the performance? And yeah, that's all my questions. Thank you.
Okay, I'll try. I hope I can remember them all, but I think I got it halfway. So the first one was, sorry, the first one was towards what the ground truth was, and that was what you said was correct. It's just the average of the global rating score of all 3 raters. Since we had 3 individual scores, so 3 raters, 3 individual scores, we just averaged them. That's one technique. You could also technically use majority voting, which is essentially calculating the mode. But we decided to use averaging to have a bit more smoothing. The second question was towards the data, I believe. So kind of the difference of this training setting where you have maybe a broader distribution of scores versus if you look at intraoperative data, you have kind of a clustering in the higher scoring range.
Maybe the question is, how do you deal with it, with the imbalance that exists? Is there any ways that you thought about dealing with imbalance when you had, if you were to have bimodal data like we do, do you have any thoughts? I think what he's getting at is, do you have any thoughts about how to deal with that imbalanced data set?
I think, yeah, it's a problem that we need to somehow address. Since, I mean, it kind of depends on maybe the focus group that we're trying to develop these models for. In one part, it's for surgical skill assessment for students for surgical training. So this is for trainees. And I think catering towards that group, it maybe makes more sense to then use the data from the trainees. I think looking into the intraoperative skill assessment, it would either be a thing that we would have to change the scale and basically say that, okay, within the super, super high skill level class of surgeons, we still see a range of skill and just kind of give that as a sort of disclaimer, or just, I guess, accept the fact that we always have a very, very small span of scores that we will be looking at for them, and that it will probably never dip below something of a 32 or so. Mm-hmm. I'm just naming numbers, not quite sure, but just essentially. Did you have any other thoughts towards that?
Yeah. Maybe to add on this, I think it's really a challenging problem to bring this kind of assessment into intraoperative scenarios. Because what I have seen is also, for example, that people then start rating complete procedures with one score, and the procedures are 1 hour long. So it's really, really challenging, and maybe also not the best strategy. So I personally would always cut videos down and maybe first extract the most important parts of a surgery and try only to focus on this part of the surgery for the assessment. And then, we kind of got around the problem a little bit because we focus on a training scenario. So we also recorded more data now during a training course where we actually can capture the development of the skill. So we actually saw also in the scores how people got better, and we have this variety now in our data, and we saw that it's also possible to then estimate this also with a model. But of course, with intraoperative data, as you said, people are much more skilled. So maybe one option would be to actually move towards very objective metrics, like something to measure patient outcome, for example. I think there has also been work going on trying to relate those objective performance metrics also with the outcome. But I think in that case, you also need really a lot of data, which is not always easy to get. It's much easier to have a few medical students and record them during training, of course. And I think what I've also seen is moving more towards error recognition. So having really a predefined list of errors that could happen, and collecting data set of those errors.
Which is also difficult because errors don't really happen super, super often. I mean, obviously shouldn't happen too often, but so having that data set is also extremely unbalanced if you have it. So
I totally agree with you.
goes along the lines of what we talked about earlier, kind of going off of Gabriel's question, of having this different, or that skill varies, especially along these long procedures. So, yeah, difficult question. And I think then the third question was about the model, and that we divided it into these different segments and snippets. Essentially, that is necessary from taking these models that are basically developed in, let's say, the natural domain, so detecting cars, people, etc., or like from these action recognition domains from which it comes from for quality assessment, is that they have clips that maybe last 15 to 30 seconds. And we have, if it's training videos, it's maybe 5 minutes. If we have surgical videos, they take hours, which can't be processed all at the same time. So we basically break them down into these smaller bits. And that's what this temporal segment network is for, is that it just keeps track of these cuts that we make, that we can just feed it the video bit by bit. And essentially, to kind of bring in a randomization factor, we divide it into these segments. And from each segment, we then extract a smaller clip, which is a snippet. And we extract that as a random position during training time. And that's what we use to train, so that we cover about, I think it was 75% of the video, or like about half of the video. And then when we actually evaluate a video, we segment them at, I think that they basically slightly overlap, these small snippets, and so that we cover more of the video and then see more of it evenly.
Got it. Let me ask. I have like a billion other questions that I'd love to ask, but I'm gonna because I do want to be respectful. I'm gonna ask one last question from my side, which is, so there are obviously a lot of kind of directions to take this work, and kind of what are you excited about now that you're thinking about, like what's next in terms of how this work is evolving?
That's a loaded question. I think ideas are going in a lot of different directions. I mean, I kind of tried touching upon it in the presentation. Obviously, it's difficult to go into the full depth. I think from some of the things I mentioned, I think looking into calculating these proxies, so like errors, or using this tool, or like metrics we can get maybe from track tools, et cetera, and combining that with the video-based skill assessment. Since from the challenge, we saw that using that does help, and kind of looking into how can we leverage that.
Awesome.
I also think that looking into maybe more modalities for giving better feedback, kind of with looking at these individual clips and how they influence the score is really important, to just be able to give the students and possibly surgeons also a bit better feedback than just saying this was good, this was bad. So maybe kind of those two directions.
That kind of effort is something that we have struggled with and we think a lot about, which is, what does feedback look like in these scenarios? Because currently the way that we think about telling someone, if you were to watch in those courses, how surgeons who are providing assistance are giving feedback to students that are learning these tasks, that reproducing that kind of feedback is actually very difficult, right? And so one can't really build a feedback loop that looks exactly like that. And not only because the surgeons themselves aren't giving perfect feedback, but also because it's very difficult to reproduce that. And so, we've been thinking similarly. I think, as you're saying, is like there have to be different ways of thinking about feedback. And, we've gone to thinking about, as you said, how do you identify errors in a video and then say, okay, well, you're doing that, generally we can ablate parts of the video, and if we ablate parts of the video and then put it back, we can tell you that your skill assessment was most affected by this part of this video. So we can give kind of these not they're only somewhat useful. They're focused, but they're not, it's not feedback like a surgeon might actually provide to a
Yeah.
student who's actually learning. And so there's a lot of questions about what does, as you said, what does an interpretable feedback need to look like? And there's certainly a lot of opportunity there. And I would obviously invite, if in the future you're interested, this is something that we're thinking about quite a bit. There's always opportunities for collaboration or even further sharing of some of these things. We feel we're very impressed by the work that you were able to publish this. We're actually trying to do something similar, which is say, if everyone can publish open data sets, then we should be able to do that. And so we're pushing our institution to allow us to do that because I think that would help everybody, just like the work that you've done is helping the entire research community. And so I think that's really fantastic efforts. But we're totally in line in saying not only the non-objective methods and metrics that people have been using, at least for us, aren't working very well. And so our questions are, how do we move to more objective measures of performance and away from raters who are saying, global rating scales are what we need, when you're like, you can't even decide amongst yourselves what a global rating scale is. So then why should that actually define what people say is skill? And then second of all, exactly right, is you're talking about, we need to think about what feedback looks like when we can't actually just have a surgeon standing next to a student and saying, this is what it means to be better or worse at this test. So really interesting work. So thank you. Any
Yeah.
last comments,
Thank you.
thoughts? Any last comments, thoughts? Guillaume, Sophia, anybody else have any other thoughts?
You kind of touched on this, and I think one really nice thing about your data set is you have the pre and post training videos, and I was curious, did the model kind of see progression in skill? Have you done kind of that comparison where maybe the accuracy of the specific label isn't perfect, but when you kind of just see, are people progressing, is it able to pick that up from what you can tell?
That's a really good question. I don't think we specifically looked at that. I mean, we did make sure that basically we kept the same student from the pre and post test separate in the training, validation, and test set, so we didn't have any leakage. But we didn't specifically look at, does the model actually catch the same student in the pre case as well as the post case and basically give a better score? Yeah, that's a really good question.
But I think from the results, we saw that it can kind of distinguish well between bad and good.
That's true. Yeah.
So I would be confident to say that it should work, but yeah.
And I mean, based off of the metrics, technically, it did have a good score. So yeah.
Very good. Okay. I've been trying and failing to keep these short because, well, I think the work that you did is fantastic, and it's really one of the pieces that there's always so much detail and so much thinking that goes into building these tools and the expertise that comes together. So I thank you for all the work that you've done, and thank you for taking the time to meet with us. And as I said, we're always excited about collaborating in the future, and we're also excited about just seeing what you guys do next. So thank you so much for joining us today.
Yeah, sure. And thank you again so much also for the invitation. It's been, very, very cool discussion and being able to, I guess, showcase our work in a sense, but also discuss in such detail. So thank you so much for the opportunity. And I think, having some sort of collaboration would definitely go along our lines as well. So thank you.
Thank you.
Absolutely. Thanks, guys. Have a good day.